Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi. And in this episode, what we're going to talk about is understanding headaches, the difference between tension headaches, migraine headaches, and cervicogenic headaches, cervical headaches. So in this episode, we're going to work on how to tell the difference, the triggers, and the evidence-based treatments that are behind them. So we're really going to look at the brain and spine connection, where we explore in depth about the neurological and musculoskeletal health. So with headaches affecting millions of people worldwide, it's really important that we distinguish between tension headaches, migraine headaches, and cervicogenic headaches. So, with that said, we're going to really dive into it and see how it affects people's lives. And let's get started. Let's get right into it. Segment one, we're going to go over some definitions and some statistics. So, first, what is a tension headache? Tension headaches are the most common types of headache. They often are described as a feeling of a tight band around the head. They affect between 30 and 80% of adults worldwide, making them incredibly common. So, to truly understand headaches and the difference between tension headaches, migraine, and cervicogenics, we're really going to understand it. So, now you understand what the definition of a tension headache is. We're going to really talk about now what they actually feel like, right? So again, I said it feels like a tight band around your head. So typically it's bilateral, means it can be both sides of your head. Although some people experience more generalized ache around the entire head, the forehead, and scalp or neck. Pain is characterized by a constant pressing or tightening sensation, often described as dull, not throbbing. What's the severity like? So typically it's mild to moderate in intensity. Very rare is it severe, and they are often more of an annoyance than a debilitation. And they're not aggravated by routine physical activities. Exacerbations, what makes it worse, right? So tension headaches are not aggravated by regular activities like walking, climbing stairs, or light exercises. That separates them from something like migraines. So how common is it? Tension headaches are incredibly common. Again, 30 to 80% of the people will have them at some point in their lives. Typically, when it becomes chronic tension headaches, which if you have a chronic tension headaches, what that means is you have 10 or more headaches per month, which that affects about 2 to 3% of the population. And women are slightly higher affected more than men. So what are the risk factors? Stress is the most common trigger and a significant contributor to tension headaches. Poor posture, prolonged computer screen, lack of sleep, hunger, dehydration are also common contributors. So basically, all your stresses of life, bad posture, looking at the computer too much, not sleeping, not eating properly, and dehydration, tension headaches. Okay, now let's define what a migraine headache is. So migraines are a neurological disorder, actually. So migraines are the most complicated and severe type of headaches. They often involve neurological changes in the brain. These headaches can last for hours to days and typically involve multi-phases. So what's the pain location? Although migraine headaches are often one side, so it's either left side or right side, they can at some point affect the entire head. What's the pain characteristics? Migraines are usually throbbing or pulsating in nature with a moderate to severe in intensity. Migraines are not just about pain in the head. Many people with migraines experience other symptoms like nauseousness, vomiting, and sensitivity to light or loud sounds. So if you ever heard of somebody who had a migraine headache and they said that I just need to go lay down in a dark room, the light sensitivity makes it worse. Around 20% of people with migraines may also have what's called an aura. An aura is basically a warning sign before the headache phase, which may include visual disturbances like flashing lights or sensory changes like tingling in the hands or face. So classic migraines, let's go over what's the classifications of migraines. Migraines are classified into several categories. Migraines with aura, formerly known as classic migraines. So what you heard as a classic migraine is now called a migraine with an aura. It involves sensory or visual warning signs like seeing zigzag lines. Next type of migraine classification is migraines without an aura, or formerly called a common migraine. So that's a head pain without any neurological changes. Next is a chronic migraine. So chronic migraine occurs when you have more than 15 days of a month over 3 months, with at least 8 of those days meeting the migraine criteria. Last type of classification is a menstrual migraine. So that's triggered by hormonal changes during a female's menstruation cycle. How prevalent are migraines? Prevalent, the prevalence of migraines affects about 1 out of 7 people worldwide, which is about 14%. Women are disproportionately affected, meaning they are about 3 times more common in women than they are in men, and that's primarily due to hormonal changes. Migraines are ranked as the second highest cause of years lived with disability worldwide after low back pain. So it is incredibly common and could be incredibly disabling, as you just heard. What are some of the risk factors and triggers? So hormonal changes in women, such as those during menstruation, pregnancy, or menopause, are common migraine triggers. Other triggers can include food like chocolate or red wine or cheese. Other changes can be sleep disturbances, bright lights, strong smell, and dehydration. There are also a genetic component with about 70 to 80% of migraine sufferers having a family history of migraines. Okay, next, let's talk about cervicogenic headaches. So what that means is a headache originating from the neck. So cervicogenic headaches are a type of secondary headache, meaning they are caused by other underlying conditions. In this case, problems arise in the cervical spine or the neck. They are often mistaken for migraine or tension headaches because of their overlapping symptoms. However, they originate from the neuromuscular dysfunction in the neck. So pain location, where does it start? So pain usually starts at the base of the skull of the neck in the back and radiates to the front or even the side around the eyes or temples. Pain characteristics, typically a constant steady ache, unlike the throbbing pain of migraines, but the pain with this may worsen with certain head or neck movements after long periods of poor posture, such as sitting or working on the computer for hours. Other associated symptoms are decrease in range of motion, tension in the neck or base of the skull, and potentially weakness or sensory problems in your arms in severe cases. How common is it? Cervicogenic headaches are less common, though precise estimates vary in studies, anywhere between 0.5% and 4% of the general population. So there's a big range of how many people are actually affected. Cervicogenic headaches are more prevalent among individuals with pre-existing neck condition, such as those who experience whiplash injuries or joint dysfunction, arthritis, or poor posture. What are some of the risk factors? So the risk factors include any kind of past neck trauma, degenerative cervical spine disease, chronic poor posture, particularly forward head carriage, caused by extended use from computers or smartphones, or as I like to call it, tech neck. Okay, so now you have a basic understanding of what each type of headache is. Now, let's further understand what the anatomy is involved in when we talk about headaches. So, the head and neck muscles. Tension headaches often involve overactivity of the head and neck muscles, such as the trapezius and the temporalis muscles. Nervous system. Migraines are associated with complex neurological changes that affect brain chemicals, nerves, and blood vessels. Cervical spine. Cervicogenic headaches are linked with these issues with the cervical spine. Problems like joint dysfunction, nerve compression, or muscle tension in the area can refer pain into the head. So somebody might ask, well, doc, how does headaches affect your life? And how did you even get it? Okay, so let's break it down. Headaches, though often underestimated, can profoundly affect someone's life regarding their productivity, mental health, and overall quality of life. Each headache has its unique characteristics that influence how it's developed and impacts individuals from mild discomfort to complete work-life shutdown. To navigate headaches effectively, understanding the specifics of their impact and development is critical. Tension headaches. Tension headaches, while they're not really as debilitating as migraines, can have a significant cumulative effect on daily life, especially if they become chronic. Most individuals experience mild to moderate discomfort that can still make tasks like concentrating or having relationships or focusing on personal goals very challenging. Chronic tension headaches can drain your energy because chronic, right? You've had them multiple times and they can drain your energy. They can increase your irritability and they can worsen your mental health. So stress, they can increase your like stress, anxiety, and depression, right? They can definitely affect your ability in the workplace to decrease your ability to work, right? Especially if you're getting headaches during work hours and it's affecting your computer work or your tasks, right? If you can't concentrate, you can't focus on what you're supposed to be doing. Individuals may unknowingly compensate for tension headaches by avoid certain activities, such as they don't stay on the computer nearly as long as they should because they know that they're going to have a headache, right? So maybe you don't put in a full 8-hour day and your job maybe it involves the computer work, and that can affect your overall productivity. How does tension headaches develop? So tension headaches typically develop due to mechanical, emotional, and or environmental factors. Stress and mental health. So mental strain and stress are the top contributors to tension headaches. Stress activates the body's sympathetic nervous system, causing muscles in the scalp, neck, and shoulders to tighten up, right? So everything tightens. Persistent stress or anxiety creates a cycle where tension headaches worsen. Mental health and mental issues are exacerbated during these types of headaches. So let's talk about physical posture and muscle strain. So poor posture, especially with forward head carriage, seen in, again, smartphone use, computer use, causes pain and pressure in your neck and shoulders, contributing to tension headaches. Eye strain. So working on computer screens, reading in low light or excessive exposure to artificial light can strain your eyes. When you strain your eyes, this can be a trigger for tension headaches, especially around the forehead and temples. How does it affect your lifestyle? So if you're dehydrated, you're hungry, or you're skipping meals, that can aggravate muscles and nerve conditions by heightening the frequency of the tension headaches. Also, if you have inadequate sleep, your body's natural repair system, right? Your natural rhythm at night doesn't get a chance to replenish your cycles. causing your muscles to be rigid and painful during this time. Okay, next let's talk about migraines. Migraines are the most debilitating type of headaches and profoundly affect every aspect of a patient's life. So, what are the challenges in work with migraines? So, unlike tension headaches, which tend to quietly linger, a migraine attack is sudden and often intense in its force, causing individuals to retreat to calm spaces. Missed work days due to migraines are significant, with being reported 100, and this is a crazy number. When I saw it, I was like, oh my God, 113 million work days are lost annually in the US alone due to migraine headaches. Again, let me say that 113 million work days lost in the US alone due to headaches, migraine headaches. That is a staggering number. How do migraines affect your social life? Migraines can cause you to withdraw from your social activities, right? If you have a sensitivity to light, sounds, or smells, that may prevent you from attending gatherings because you're afraid you might get nauseous or headaches, and it might restrict your ability to do some physical activities. Over time, individuals may lose confidence in their ability to maintain relationship or commitments because they're afraid the headaches are gonna pop up. How does it affect your mental health? So chronic migraines are often associated with anxiety, depression, and even suicidal ideations due to the disruptive changes and the nature of the repeat attacks. The unpredictability of migraines can cause individuals to live in anticipated fear, always wondering, when will it happen again? Will I be okay? Can I go to this event? Can I go to this party? Can I go to this family gathering? Can I go to church? Can I go to a movie? You might think, well, of course they can. But if you're a migraine sufferer and you go to a movie and maybe that movie has loud sounds and bright lights, and that might be one of your triggers. So maybe you don't go to that, right? Maybe you're afraid of going to a baseball game, football game. The crowd gets very, very loud, and that loud sound might trigger a migraine. You might be afraid to do that. So while anybody who doesn't have a migraine won't understand that, but the people who do have it understand it all too well. So here's a question. How do migraines develop? Migraines are considered complex headaches and often develop due to various triggers and neurological mechanisms. So the neurological changes that are associated with these types of headaches are hyperactivity in the brainstem, abnormal levels of neurotransmitters like serotonin, and heightened sensitivity to the trigeminal nerve, which is responsible for transmitting face and head pain. This leads to vascular changes where the blood vessels in your brain dilate. Dilate means they open up and cause inflammation, resulting in throbbing head pain. That's why you get the throbbing, right? So your vascular system opens up a little wider than it should, and the blood's pumping more. So you're getting the pressure of the throbbing of the veins. You never thought you knew, but now you know. Okay. Migraine triggers. They can be triggered by internal or external factors like, first one we'll talk about is hormonal changes. So hormones like estrogen play a key role in migraine development, explaining why migraines are disproportionately affecting women during menstruation, pregnancy, or menopause. Migraines can also be triggered by food sensitivities. So foods like aged cheese, chocolate, red wine, artificial sweeteners, MSG are common migraine triggers. So if you have those triggers, you want to avoid those types of foods. Environmental factors, bright lights, loud noises, strong smells, and even changes in weather or the barometric pressure are known to be triggers for affecting migraines. Stress. Stress activates your body's uh, flight or fight response, causing your vascular system and your muscles to tension and change. That can trigger a migraine. Sleep disturbances. So if you have poor sleep, you sleep maybe 3 hours a day, or you have ineffective sleep, or you oversleep, or you wake up constantly twisting and turning, that imbalance can cause you to have migraines. Okay, last on the list, cervicogenic headaches. Cervicogenical headaches can be particularly disruptive, especially when the underlying cervical dysfunction is chronic. So physical limitations of the cervicogenic headaches often exist with neck stiffness, reduced range of motion, and physical discomfort. Individuals may feel unable to turn their head or tilt it backwards, or basically move it and during normal tasks without pain. Persistent problems in the neck can cause participation in physical activities and even the simple tasks such as driving, sleeping comfortably to be problematic and cause pain. Cervicogenic and its cognitive and emotional strain. So pain can start in the neck that spreads to the head, making concentration and mental clarity difficult, especially for jobs requiring head and neck stability, sitting at a desk, or giving a presentation, right? It can affect all aspects of that part of your life. Chronic pain cycle. If the cervicogenic headache remains unresolved, they often contribute to a chronic pain cycle where fear of triggering neck pain can lead to avoidance of everyday activities like exercise. Over time, inactivity exacerbates further weakness and dysfunction in the musculoskeletal system. So how do these happen? How do you get a cervicogenic headache? So typically these headaches arise due to dysfunction in the structures in the cervical spine. What conditions can cause this? So conditions like cervical spondylosis, arthritis, herniated discs, whiplash. Those are the most common culprits for cervicogenic headaches. It's not the full list, but that's the biggest culprits. These conditions can irritate or compress on spinal nerves or joints that refer pain to the head and cause dysfunction. When you talk about the muscles in the neck, sometimes you could have overuse or strain or sprain of the neck muscles and ligaments, causing the muscles in your neck to go into spasms. So whether it's your trap, your upper neck muscles, that can all lead to cervicogenic headaches. When you sustain poor posture, such as forward head carriage over time, that places excessive strain on your cervical joints, leading to chronic headache patterns. Trauma. Trauma is definitely the last, probably one of the bigger ones that cause cervicogenic headaches. So direct trauma to the neck, such as whiplash from a car accident or a slip or fall, can be a big contributor to this condition. Damage to cervical ligaments or muscles create instability in the neck, which can lead to referred headaches. So next, let's talk about the domino effects of headaches on life. Across all types of headaches, the cycle of pain, avoidance behaviors, and emotional distress can create long-term impacts. It can reduce the quality of your life, right? Chronic or recurrent headaches can lead to decrease in your activities, your physical activities, your job engagement, and your social interactions. The headaches can affect your mental clarity. So headaches are linked to anxiety and depression disorders. So individuals struggling with that can affect your ability to think clearly, focus, and basically keep you into that headspace of having that migraine. Workplace productivity loss. We talked about this. Headaches cost billions of dollars annually due to migraine headaches. I still can't believe that number, 113 million days lost due to migraines every year in the US. It is a big, big problem that we really got to try to help patients with. So understanding the difference between the type of headaches is important. So let's just recap it really quick. Tension headaches usually feature a dull, constant ache on both sides of the head. Migraines typically present with a throbbing pain on one side, can be both, but it's usually one side, accompanied by either you could have nauseousness, you could have an aura, you could have visual disturbances. Cervicogenic headaches is headaches that are come from pain that starts in the neck and is affected by movement and changing positions. Okay, so now you understand what headaches are. You understand the differences between the three. What do you do about them? So, first conservative treatment that we'll talk about is physical therapy. For tension headaches, physical therapists focus on muscle work to improve neck mobility, motion, and ergonomic adjustments for your desk or how you stand, sit. For cervicogenic headaches, physical therapists typically target muscles that can improve cervical spine function and reduce muscle tension. Chiropractic care will be the next. Chiropractic care will do spinal manipulations, especially beneficial for cervicogenic headaches, which when you get a chiropractic adjustment, you alleviate the joint pain and pressure and affect the muscles and the tension in the neck around it. We also can do soft tissue therapies, addressing tension headaches by affecting their symptoms by utilizing different modalities to help reduce the pain and inflammations that are in there. So typically, chiropractic and physical therapy can help with headaches because they're going to work on the muscles around the head and neck and get you more mobile, more functioning. The non-conservative treatments are going to be NSAIDs, right? First line especially for mild tension headaches. They might put you on some stronger medications for acute migraines. And there's a long list of different medications that they're going to use for migraine headaches right now. But they're going to put you on NSAIDs first and then medications to affect specifically for migraines. Another thing they might do is cognitive behavioral treatment, CBT. It's helpful in chronic tension headaches and migraines to manage stress and developing coping strategies. A new technique that they've done, well, not that new anymore, it's been around probably for the last 5 to 10 years, is Botox injections. FDA approved for Botox for chronic migraines. What it showed is Botox can reduce migraine frequency by relaxing the hyperactive muscle. So it basically decreases the muscle sensation, helps you relax in there. So understanding the different types of headaches is important for you to understand what type of headaches you have. This way you know what type of treatments you can do. When you look at this comprehensive look that we just looked at for the tension headaches, migraine headaches, and cervicogenic headaches, understanding those differences between them is critical. Understanding what the triggers to bring them on is critical. And understanding that you do have treatment options out there to help you manage your headaches more effectively. And if you are experiencing persistent or severe headaches, please consult your healthcare provider for your own personalized care. So the information I've given you today is my opinion alone. Please do not take anything I say as medical advice or medical treatment. It is my opinion alone. If you have a problem, please seek out your own healthcare provider for your own individual evaluation. As I always say, we only got one of these. Your health really matters. Yeah, especially your head health, your mental health. Mental and physical health, it's important. Don't let conditions linger. Go get it treated. We treat patients all the time with really good results. Don't wait. Don't stay in pain. You can get out of it. It's possible. We do it every day. Have faith in it. As I always say, your health matters. So take control of your health. Be healthy. Be smart. Till next time, I'm Dr. Chillemi. Your health matters.